An estimated 7.7 million people globally died from bacterial infection, according to numbers from a global burden of disease study. But antibiotics give people a fighting chance against those infections. Dr. Michael Paglia joins me on Antibiotic Awareness Week to talk about the proper use of them and what can happen the more they are prescribed. Hi, Dr. Paglia, how are you doing?
I'm doing well. Thank you for having me.
Thank you for coming on the show. So I guess we'll just talk about the good things that antibiotics do first. Let's talk about, how they fight infection.
Yeah, they are really truly one of the modern miracles of medicine. We can treat all sorts of very serious infections, ranging from things that people have heard of like sepsis, pneumonia, urinary tract infections, skin infections like cellulitis. So they certainly give us a whole range of options for treating serious infections that are affecting a lot of people.
But there is something called antimicrobial resistance that is built up over time. I guess explain that to me.
Yeah, essentially the bacteria that we're treating with antibiotics develop what we call resistance mechanisms. So they become more resistant to the antibiotic over time. And the more we use the antibiotics, the more that resistance will accelerate. So we just want to make sure that when we're using them in appropriate scenarios and when they're really indicated.
So when it comes to, proper usage, are there some situations where the antibiotics are prescribed, more frequently than other situations? And if so, how do we maintain that we don't build up that resistance?
Well, it's important to kind of distinguish what antibiotics work for and what they don't work for. So one, obvious example that we all would be familiar with is COVID. And influenza is another virus. So viruses do not respond to antibiotics. There are antiviral medications that work for those, but they do not respond to antibiotics. So it's important that when we have a virus, we don't prescribe an antibiotic. And so that's important for both patients and providers to remember, is that when it's not a bacterial infection, you don't need antibiotics.
So let's talk about Antibiotic Awareness Week, because obviously there's a whole week dedicated to this issue. Why is this issue so important to, voice, I guess, get the message out?
It's really important to raise awareness. I think we should be encouraging patients to have conversations with their healthcare providers, especially when they're recommending an antibiotic to, say, is this the only option? Is there a confirmed bacterial infection here? And the reason being is the projections of resistance are increasing over time across the globe. So we know that COVID has created a setback. Resistance was improving leading up to COVID. And since COVID, we've seen a kind of a backslide as far as this resistance question goes. So we really want to make everybody aware that antibiotics are really unique among all medications, and to have those conversations with their providers about when and when not an antibiotic would be indicated.
Dr. Michael Paglia, thank you so much for joining me today. Have a great Thanksgiving, okay?
Thank you so much, you too.
Thank you, sir.